Are you struggling with frequent heartburn or acid reflux? You may be surprised to learn that your diet could be a major culprit. My name is Dr. Terranella, and in this video, we're going to uncover the foods that worsen your acid reflux, why they might be having such an impact on your digestive system, what's the mechanism involved, and what you can actually do about it to reduce your symptoms of acid reflux. As I said, my name is Dr. Terranella, and this channel is dedicated to helping you understand and optimize your health. If you're getting a lot out of these videos, hit the like and subscribe to continue getting videos like this. Let's look at the foods that worsen acid reflux. So here we want to look at the foods that can worsen acid reflux. But of course, before we do that, we want to also understand what is acid reflux, and then we'll look at some of the causes and the foods that contribute to those causes. So what is acid reflux? Well, acid reflux is a condition where the stomach acid flows back up into the esophagus, causing a lot of discomfort and various symptoms. And this reflux can happen for a few different reasons, which we'll discuss. But most commonly, it's associated with a malfunction in the lower esophageal sphincter, also known as the LES, which is a valve or muscle that allows for the opening and closing of the esophagus as it empties the contents into the stomach. And it prevents the contents from flowing retrograde upwards up into your esophagus. Some common symptoms or sensations that are associated with acid reflux. The primary one is going to be heartburn, which is a burning sensation in your chest and can often extend into the throat as well. Other associated symptoms can include things like regurgitation, so food actually coming up with acid back into your mouth or maybe just below your mouth. Sometimes people will have dysphagia as well, which is difficulty in swallowing food. Chest pain, which sometimes can be mistaken for a heart attack. Chronic persistent cough can also be caused by acid irritating the esophagus, causing you to want to clear your throat or cough, particularly close to consuming food. Hoarseness or sore throat can also be common with acid reflux, and it's due to the acid actually coming up and irritating the vocal cords. Nausea, particularly after eating, is also quite common with acid reflux. So the foods that worsen acid reflux do so for specific reasons. And while some foods are often more commonly associated with triggers than others, the triggers aren't universal because not everyone has the same cause for their acid reflux. So let's look at some of the general causes first, and then we'll look at the foods that seem to enhance or make those causes a little bit worse. So the first one that we want to talk about, and this is in no particular order, by the way, is lower esophageal sphincter weakness. The lower esophageal sphincter may be weak or loosen, allowing for stomach acid to escape into the esophagus. And some people have an inherent weakness there, and some foods certainly can worsen that as well. There's also increased gastric pressure, and the pressure there in the stomach can force the acid up into the esophagus. And this can be caused by things like just being a bit overweight. The increased girth in the abdomen can press on the stomach, and also when you're eating large amounts or if you're overeating, the increased food in the stomach can also cause increased pressure there. So SIBO is another thing that can cause increased pressure because the excess bacteria in the small intestine produce gas, increasing the overall pressure in the abdomen, similar to being overweight or excess weight, which can then press on the stomach and increase the propensity to acid reflux. Another common cause for this is increased acid production. So higher levels of acid in the stomach can increase the likelihood of that acid affecting the esophagus. And foods that are higher in histamine often trigger the stomach to produce more acid. And then the other common cause is H. pylori. This bacteria actually can elevate the acid production through the increased release of histamine. Lastly, there is delayed gastric emptying. Slow digestion keeps the food and acid in the stomach longer, leading to the increased possibility of that food creating pressure in the stomach and also the acid getting into the esophagus. So maybe you're wondering which of these mechanisms or which foods are actually making these things worse. So let's take a look at some of the foods that can actually make these mechanistic things more prominent. With most of these foods, it's really about the overall quantities that you're consuming. And some people might be able to get away with small amounts of these on one particular day, but on another day, they can't even deal with small amounts of it. So there's multiple things kind of layering here, but most will experience symptoms with higher quantities. The mechanisms of your particular acid reflux is important to consider, and sometimes identifying the foods that are triggering you may also lead you to understanding which mechanism is involved. So high-fat foods like fried foods, fatty cuts of meats, and full-fat dairy are going to tend to relax the lower esophageal sphincter and slow gastric emptying, increasing the risk for acid reflux. Chocolate is another food that contains caffeine and theobromine, which can also relax the lower esophageal sphincter and increase the chance of acid production. Spicy foods like chili peppers, hot sauces, and curries can irritate the esophageal lining and also are going to contain more histamine, which is going to lead to higher amounts of acid production. Citrus fruits and tomatoes also contain higher amounts of acidity in them and also increase acid production because they also contain higher amounts of histamine. Alcohol is also associated with acid reflux, and it does so by relaxing the lower esophageal sphincter, and alcohol also contains higher amounts of histamine, which increases acid production. Carbonated beverages, obviously that carbonation can increase the pressure in the stomach. So if you're reacting to this, it could be more of a mechanism of increased stomach expansion or increased gastric pressure that's contributing to your particular issues. Coffee is another common food or drink that can lead to problems with acid reflux because the caffeine in the coffee relaxes the lower esophageal sphincter and also increases gastric acid production. Similar to the carbonated beverages, foods like FODMAP foods can also be an issue because they increase gas production and bloating in people that do have SIBO. And if you're triggered by these foods, it's very likely that you might have SIBO, and that's what's contributing to your acid reflux. These would be things like broccoli, beans, onions, cauliflower, even apples. Gluten, of course, and dairy are also common FODMAP foods, and these all can increase gas production, which can then potentially worsen your acid reflux if you are producing more gas from these. So now that we have the foods and categories of triggers, you may be noticing a pattern in your diet that might be causing your discomfort. So let's connect the dots a little bit further on this. So fatty foods, chocolate, and alcohol can relax the lower esophageal sphincter, allowing for more acid to escape into the esophagus. In some cases with things like this, you may benefit from adding additional enzymes or acid to help improve the overall digestive capacity and enhance the gastric emptying into the small intestine. Increased gastric pressure will the gas production from SIBO and carbonated beverages. If that seems to be causing more of your problem, avoiding the high FODMAP foods can help reduce the increased gas production from the SIBO and reduce the overall gastric pressure there, allowing you to have less acid reflux. In addition, if this seems like more of a trigger for you, you might want to get screened for and treat your SIBO or small intestinal bacterial overgrowth. Of course, overeating and being overweight can also be a contributor here, and the suggestion there would be reducing caloric intake and trying to reduce your weight. If it seems like you're being triggered by more of the acidic or high histamine foods, these would be like the spicy foods, citrus, tomato, and other high histamine foods. You may want to look at the overall foods that are high histamine and try and avoid those to see if maybe that's going to reduce some of your symptoms. Coffee also stimulates increased stomach acid production, so that's another one to consider. And in this case, it may be helpful to reduce some of your high histamine foods, or also take some herbal things like slippery elm or marshmallow that can soothe the esophageal lining. In this case too, it's important to consider getting screened for H. pylori, as when you have more acid production, when you're more sensitive to those higher acidic states, you may be dealing with more of the H. pylori, and getting rid of that is going to lower the overall histamine production in your body. As we mentioned, fatty foods can slow the digestion and keep the food and acid in the stomach longer. These are going to be higher protein foods, higher fat foods sitting in there longer. So if you seem like you're being triggered by things like red meats or high fat foods like dairy or greasy fried foods, this may be an indication again to add in some digestive enzymes that's going to help with the breakdown of those foods. So understanding the interplay between different foods and the mechanisms involved with acid reflux is going to help you prevent and manage your symptoms. The go-to for people with acid reflux is to use acid blockers, and these are intended for very short-term use, like 2 weeks, maybe a month. They're not good for the long run because mainly they're going to deplete your overall digestive capacity and reduce the absorption of important nutrients. So by recognizing which foods might be triggering your reflux and how they affect your body and digestive process, you can make a more informed dietary choice and also potentially get at the underlying cause of your acid reflux. Understanding the causes can also help you and your doctor find an effective treatment plan that does not involve acid blockers. So hopefully this video helps you better understand the foods that worsen acid reflux. If you do have questions about anything in this video, drop it in the comment section. I'm happy to answer your question. If you want a more nuanced, customized answer, consider joining the membership program. We'll have more time and attention to dedicate to your question. If you found this video interesting and you want to learn more about how to manage your acid reflux or other digestive symptoms, you might want to check out this video here. Thank you again for watching. We'll see you next time.